Come on. Seriously? This isn't a game? Fiery face-offs, axe to grind, and grown-up Gollum? Is that you? Today we're breaking down and reacting to the shocking medical scenes and action-packed injuries from Skyrim. Let's dive right in. Oh!
My ancestors are smiling at me, Imperials, and you say the same.
Come on. Seriously? This isn't a game? I did a TV show where I was on the History Channel. The show's called Dark Marvels, and literally there's a whole episode about these type of events that occurred in history. The guillotine, using the axe, and they actually got away from using the axe because the person that was wielding the axe actually didn't do a very good job half the time. You need to be able to get through skin, muscle, all the ligaments and the tendons in one big fell swipe. People thought that somebody could be aware after their head has been chopped off, and they thought it could be like lots of seconds where somebody's blinking, looking around. The likelihood is probably a quick few seconds that you see movements. I've seen it before when somebody actually dies, but they're actually still looking and talking for literally a second or two after. It's just because there's still some interaction, action potential still left, but not continuous. So, Oh! Head compression, so slamming somebody down on their head, the likelihood that it's going to cause brain injury is probably not that great. It could. You can cause a skull fracture, laceration to the top of the head. But the thing that we worry about besides that, obviously, is your cervical spine. But we actually have to worry about the spine all the way down because you have compressive force that can like share the energy all the way down. So if anybody has pain anywhere along the spine, you have to get imaging of the whole entire spine to make sure that there's no fractures. Oh, whoa, what kind of move was that? So you could literally internally decapitate somebody where you're severing the autonomic nervous system, basically, your brain stem from the rest of your body, so then there's no function. Whoa! Landing on concrete on their thoracic spine can cause fracture, could be caused what we call a step off. When somebody comes in as a trauma, we don't ask them to stand up, we actually roll them on their side so that way there's less spinal movement. And then we run our hand along the spine and see it, one, does it hurt, and we're pushing each area. And then we're actually feeling for a step off. Step off meaning like, is there a big like gap?
They mustn't stop.
Oh, okay. We got a nice laceration injury to the left flank. Ribs might have protected it, but the lower part of the ribs is protecting your spleen on that left side. You can live without your spleen. There are just certain vaccines that you need to prevent yourself from getting certain encapsulated bugs, so to speak. People get splenic ruptures occasionally. You need to go to the OR and have it removed just because it's an increased risk of bleeding in there. Death by fire doesn't happen as much as you think in the real world, but we do get burns from like hot elements, water, coffee, soups. Those are the kind of common things that people would burn themselves on. Occasionally you get a house fire. Occasionally you get an explosive type injury from whatever somebody's usually playing around with. Whoa, nice. We got spells galore going on. We got electrical injuries. We have alternating current versus direct current. Most of the appliances in our home are AC, so alternating, those are the ones where you can't let go. You grab onto and you're stuck, and this causes a lot of contraction, versus DC basically causes you to like get hit, get explode like the power grid. Both of them, we really worry about muscle breakdown due to burning of the muscles, okay? Rhabdomyolysis, kidney failure, high potassium, hyperkalemia, other electrolyte abnormalities. Oh, whoa, what a cool sword. Huge blade straight through the lower back going up, ripping through probably a couple different organs because you're going down from the lower back. People complain of lower back pain when they come to the emergency department. Typically it's equivalent to like either a uterus or bladder infections, urinary retention, that sort of thing. And then you have your intestines, you have your kidneys in the back, you got your ureters. An explosion that sends you flying backwards, right? So worry about what you're landing on. Falls greater than 15 feet increase the risk of severe trauma. First, you have the blast injury, pop your eardrums, you can pop your lungs, you can injure hollow organs. Then you can have blunt trauma due to the compressive force, you can fracture ribs. Wow, look at these guys. Knock out the legs on the big people. Injuries to the lower extremities. We see commonly patella tendon ruptures. We see lacerations and injuries to like feet, but most of the time like knees and thighs, it's a lot of blunt trauma and a lot of ruptured tendons, ligaments. Obviously people out there have had ACL injuries. The knee swells up really bad and it actually becomes really difficult to even walk with that type of swelling. Lacerations to upper extremities, just put compressive force to those areas if you have them. Obviously, I see an arrow in the left shoulder. Difficult to push all the way through because you have the scapula on the opposite side. You do have major blood vessels that are close to that area, as well as you have something called your brachial plexus, which is where all the nerves from your neck cruise out, cruise underneath and come out your axilla or the armpit. So you have to be really careful with those structures. Oh, good shot right at the distal thigh. You have your quadriceps, right? So the attachment of your thigh or your quad to your knee. The point of your quadriceps muscles, obviously, that good strong extension that we have, right? The flexion of our leg at the knee is due to our hamstrings, but the extension is the thigh, obviously having to do with walking and stability. Oh! Nicely lacerated in the neck.
Look at that neck!
Didn't seem to do much. Check out that structure. You can see the clavicle is pretty easy. Super easy to break that bone. If a child is being born and they have something called shoulder dystocia, where the shoulder actually gets stuck on the mom's pelvis, basically, there's different techniques to try to get that baby out. It's an emergency. Oh, man. Those are not good veins. In that area, I imagine you have your external jugular vein, as well as your internal jugular vein, as well as the carotid artery. The EJ is what we call it in the business, so to speak. Sometimes you can use that as an emergent IV line. Typically, when you have an IV put in you, somebody uses a tourniquet, right? You can't use a tourniquet on somebody's neck, so you need to be really good at finding veins if you're going to use an EJ. We got a lot of blood splatter happening. Could that happen? A little dust to splatter from a lot of force? Potentially, usually not the first slice, maybe a second. So we're seeing blood squirt from the left buttocks. People have significant amount of pain actually in the left buttocks commonly because the sciatic nerve comes out there. Sciatic nerve is basically made up of nerves of your lumbar spine in the back, and then they form the sciatic nerve that passes through the piriformis or around the piriformis muscle in the buttocks and comes out. Holy smokes. That is a big spider that you want to get away from. Typically, spider bites that we see that people get super worried about when they come to the ER is a brown recluse and a black widow. Everybody freaks out about those. I don't like spiders either. We have a lot of brown widows in California, not as much black widows. Seen many of them on the East Coast. Once you actually get bitten by a brown recluse, unfortunately, it starts breaking down into tissue. Cool game. A lot of graphic, good storyline. Also, I made fast-acting health supplements with you in mind. No matter what the issue, I got you covered. Check out Life Happens. You take them only when you need them. If you guys enjoyed my reaction to this, definitely check out this playlist right here. Binge watch everything. And as always, do me a favor. Helps the channel keep going. Subscribe. Turn on your bell notifications and hit that like button for me. Thank you so much for watching and stay healthy, my friends.